COVID vaccines are really one of the fantastic results of a lot of medical research over the last really 20, 30 years in developing vaccines. The vaccines have been shown really to be quite protective very quickly after getting the vaccine from the really bad effects of COVID. And remember that COVID, over 280,000 Americans have died from COVID. COVID is a very significant and severe disease, especially for those with risk factors. And that's the biggest reason for patients to get the vaccine, especially if you're in one of these risk groups. Know that there also is a very rigorous safety process with the FDA, as well as with the CDC, which does an independent review of all of the data after the FDA has done their review. And in certain states like Washington State, we're actually doing a third review with a multi-state collaborative of experts. Several people that I know are on that panel who will be also reviewing for safety for the vaccine. So know that there's a lot of expert eyes looking at it from a patient safety perspective to make sure that that vaccine is safe to give to you to protect you and your loved ones from COVID. The vaccine is going to be rolled out over time, and there's probably going to be multiple vaccines that come out. There will eventually, and probably just in the next several months, maybe 4 to 6 months, be enough for everyone who wants it. But in the meantime, it'll go to those at highest risk or be offered to them first. Once my turn comes about to get the vaccine, I will absolutely get the vaccine. It's not only to help protect my own health, but it's also protect the health. I have several elderly parents and in-laws, and we'd like to visit them, and we haven't been able to recently, and I want to make sure that it's the safest for them. So I feel very confident with the current level of scrutiny that the vaccines will be having by worldwide experts on vaccine safety. And so, I will definitely get it. My turn, will come up, and I will be in line like the rest of everybody to get the vaccine when it comes about. I do think that it'll be safe, it'll be effective, and it'll keep my elderly parents healthy, and that's what I think we all want.